Hello, everyone. Thank you so much for listening to the podcast. Today, we have a very good friend of mine, Dr. James DiNicolantonio, on the show today. He is the author of The Salt Fix, and he's going to be talking about the different types of salt you should be eating, the differences between sea salt and regular table salt that a lot of people are consuming every day, how there are microplastics in sea salt, and his top recommended salts, and how salt creates more energy in the body, and how you should dose salt, like how much salt do you need every day. This is a very, very good show, and definitely recommend his book, The Salt Fix. Our guest today is Dr. James DiNicolantonio. He is the author of The Salt Fix. He is a cardiovascular research scientist at St. Luke's Mid-America Heart Institute in Kansas City, Missouri. Dr. Nicolantonio's research focuses on nutrition and cardiovascular health. He is the author or co-author of over 200 publications in the medical literature. Dr. James also serves as the associate editor of BMJ Open Heart, which is a cardiology published in partnership with the British Cardiovascular Society. You can learn more about Dr. Nicolantonio on the links below. James, thank you so much for coming on the show.
Thanks for having me, Wendy.
Why don't you tell the listeners a little about yourself and how you got into the health field?
Yeah, so I'm a doctor of pharmacy. I'm also a cardiovascular research scientist at St. Luke's Mid-America Heart Institute. I started publishing, almost a decade ago, really, and it stemmed from, in regards to salt, from when I was a community pharmacist working with patients, hypertensive patients, and they were kind of being put on these low salt diets and actually suffering a lot of consequences. They were dizzy, elevated heart rate, exercise intolerant all of a sudden, and they're especially like orthostatic hypotension, like going from a seated to a standing position. And so, I really kind of pushed back to my patients and saying, this low salt advice doesn't seem to be doing you any good. And they would go to their doctors, and sure enough, their blood sodium levels were super low. And as soon as they upped their salt intake, like all their symptoms went away, like their heart palpitations went away, their muscle cramps, all of that. So, really that kind of spawned me into actually researching salt and writing the book. And that's really kind of like, that's kind of how it all happened.
So how did we get here? Why is it that medical doctors are telling people to not eat salt and haven't made that differentiation between table salt, which is very toxic, and sea salt, which is necessary for life and perfectly matches our body chemistry?
Yeah, so I think it's kind of like two questions. Like, how did we get to where we're recommending like the low salt advice, and then why is there no differentiation between salts that are out there? And so really like the low salt advice is basically like it stems from the same thing as why we believe low fat, low cholesterol. It all comes back to those 1977 dietary goals. It's like, I've said that so many times, but that's literally where basically our nutritional whiplash that we're dealing with now stems from. And basically it was just the opinions of a few people. Senator George McGovern, he kind of created this select committee. And Nick Modern, who really wasn't a research scientist or anything like that, he didn't really even have any type of nutritional training, was kind of tasked with creating these dietary goals, and he mainly relied on Mark Hegstad. So it was like, and it was written just by like a few people. So it was the advice to go on a low salt diet and a low fat diet and a low cholesterol diet and a high carb diet. It all stems from just a few people back in 1977. It's crazy.
Wow.
That, we were brainwashed for 40 years, but there was never any systematic review or meta-analysis of studies back then. There was no like need for evidence. It was like if you like had a high enough position and you had enough clout and you said salt was bad and you recommended low salt, it's literally what happened. And that got integrated into our 1980 dietary guidelines, and the low salt advice was just updated every 5 years ever since. No one's ever said, did we even ever have any evidence to recommend low salt diets.
And now we have the internet to get educated.
Yeah, exactly. And the other question that you asked is like, why we're just starting to realize that, table salt might not be the healthiest salt. And even even beyond that, in my book, I kind of push even beyond even sea salt, because some studies are coming out that even modern day oceans are contaminated with modern day pollution, and that gets into modern day sea salts like microplastics and things like that. And so I even go a step beyond in the book, and like my number one recommended salt is Redmond real salt, because it's from an ancient ocean and it doesn't have those potential microplastics and heavy metals and things like that that are found in some modern day sea salts. Not to say that they can't like remove some of those things, which some of the higher tier modern day sea salts may do, but it's kind of up in the air, right? And so I don't want to risk that, so I kind of go for an ancient ocean salt. And I have a nutrient analysis table of some of the more common salts, and I kind of show that a lot of the salts don't necessarily have very high minerals, except for iodine in general. Certain salts have a good amounts of iodine. Like Himalayan salt does have good amounts of iodine. It just kind of depends on the batch that you get. You can get less than 100 micrograms of iodine per 10 grams of salt, and I've seen some as high as 1,000 micrograms. Just depends. Whereas Redmond has about 170 micrograms of iodine. So good amounts of iodine in Redmond, and it has good amounts of calcium, which we sweat. We sweat both, not just salt. We sweat out iodine and actually really good amounts of iodine, between like 50 and 100 micrograms of iodine per hour exercise, which when I discovered that, I was like, whoa, that's crazy, right? Because we're supposed to be consuming 150 micrograms a day, and you could be losing 100 micrograms an hour of exercise, which is kind of cool. So if you're not like eating a salt that has good amounts of iodine, you're obviously potentially becoming depleted in iodine. And so I think a lot of people who are exercising, like just constantly sweating out salt and iodine, are slowly depleting themselves of those important minerals. And of course, your metabolism is tied to iodine, because your thyroid hormones are made of iodine, and so you can literally be storing more fat simply because you're not getting enough salt. And it's kind of crazy to think that, but there's definitely a link there.
I recommend all my clients take iodine unless they don't tolerate it for some reason. But yeah, the 150 micrograms, I mean, they're not accounting for all the chloride and fluoride that block its uptake in the thyroid, and you kind of have to take a lot more than 150 micrograms per day that's recommended by the RDA. But also, a lot of people are eating table salt. Like I was for iodine. I was at my aunt's house one day, and I'm like, why are you eating table salt? Like, why would you eat the Morton's garbage when you could be eating sea salt? And that's kind of like a very similar cost, price point. But it's for iodine. And I'm like, well, you could just supplement iodine separately. You don't need to get it in your salt.
Right. I mean, and what's kind of crazy too is we don't even know the bioavailability of the artificial potassium iodide that they put in table salt. Apparently, some people say that the bioavailability is like less than 10%, whereas like natural iodine apparently has a bioavailability of about 100%. So you think you're doing something good by consuming iodized table salt, and it may not necessarily be the best thing. And I mean, I never even realized until a couple of years ago that your regular old Morton table salt, when you look at the back of it, it's got dextrose added to it. It's bleached white. It's highly refined, and it has anti-caking agents in it. And
aluminum. They use aluminum as an anti-caking agent.
Right. And so, I mean, I don't think a lot of people really understand that. And so once you realize it, then, it's kind of easier to make the case of why you should be consuming, more natural salts.
Yeah, I've heard. Is there microplastics in the like table salt, regular table salt, or do you think that's just the oceans?
I think it's just the oceans, yeah, because table salt is mined, and so I don't think it necessarily has those microplastics.
And so what exactly is in table salt? What is that the majority of Americans are eating? 'Cause I know, say when you go to a restaurant and, a lot of us go out to eat and you have a meal full of table salt, I feel so sick. And I know it's the salt. I've gotten way too much salt, and it creates an imbalance in your body because there's a way more sodium content in the regular table salt than there is a sea salt. Can you explain what's in the salt and what's going on there?
Yeah, so regular table salt, like you just said, is just plain salt. It's sodium and chloride, and so the rest, maybe the 2% of the salt is composed of dextrose and other things. And so other salts contain up to 84 different types of minerals, and so some salts have decent amounts of magnesium. A lot of the sea salts seem to be decently high in magnesium, but they generally lack iodine. So it just kind of depends on It depends on the person. Some people, their diets really are low in magnesium, and you might want to consume a salt that's higher in magnesium. And then some people, they're exercising all the time and sweating out a ton of iodine, and maybe they should be consuming red mineral salt because of the iodine content. So it just kind of, depends on, your individual self.
Yeah, and so with the sea salt, it has 84 different minerals. Can you explain how we need that? Because our blood plasma has 80 plus different kinds of minerals. Like, we need that to replenish the minerals in our body, because the minerals are the spark plugs of the body. They make our body work in so many different ways. Can you talk a little about that?
Yeah, I think we like everyone has just, and really the medical community and health associations that kind of pin everything on salt have kind of lost the overall picture, and that's really the overall dietary pattern. And salt is fine to consume as long as it's balanced with a few particular minerals seem to be very important that you need to be consuming adequate amounts of, and that's potassium and magnesium with sodium. And so potassium does have a mild type of diuretic effect, and so if you're consuming between maybe 4 to 6 grams of potassium a day, all the population studies show that even consuming 4 to 6 grams of sodium per day is completely fine. The Japanese, they consume a much higher amount of potassium than we do in America, about 2 to 3 times the amount. And so, we kind of wonder, why do the Japanese, how can they consume so much salt and live the longest, right? Well, they're eating a real diet, and they're getting their salt, salting the taste and getting salts from seaweed and things like that. But yeah, what's crazy is a lot of the selling point for salt is that salt actually helps maintain our magnesium status. And the reason is, if we don't get enough salt, our body's going to pull it from somewhere to maintain normal sodium levels in the blood. And what ends up happening is the body will strip the bones of sodium, but at the same time, it's stripping them of calcium and magnesium. So literally, if you want to go on a low salt diet, there's been numerous balance studies that have shown that it actually causes people to go into a negative sodium balance, and the bone is being stripped of magnesium as well, and you become a negative balance of magnesium and calcium. And so if you want to maintain healthy bones and you don't want to strip them of calcium and magnesium, you need to be in a positive salt balance.
Yeah, and I've heard that, sodium and potassium, they are minerals that keep calcium dissolved in the blood. So if you don't have adequate amounts, you can't hold on to calcium. It'll metastasize into your soft tissues where it doesn't belong.
Yeah, I mean, magnesium controls the sodium-potassium pump. And so what ends up happening is, if you don't have enough magnesium, you start accumulating sodium within the cell, which causes an accumulation of calcium, which causes vascular calcifications and arterial stiffening and vasoconstriction, hypertension, you name it. And everyone's focused on salt, and it's like, well, magnesium controls sodium accumulation in the cell, much more important than just salt intake. And so I think magnesium is kind of like the missing mineral in a lot of people's diets. And if you can balance that and eat adequate amounts of potassium, magnesium, eating a normal salt diet does not appear to be detrimental. It actually appears to be very beneficial.
What are some of the harms, other harms you can talk about cutting salt out of your diet?
Yeah, so salt is composed of sodium and chloride. Most people understand some of the benefits of sodium, right? Like maintaining a blood pressure. We need a blood pressure. Everyone fears blood pressure, but it's like, if we didn't have a blood pressure, you and I wouldn't be talking right now. And so it maintains blood circulation, and sodium allows actually us to absorb vitamin C in the intestines. Sodium brings in vitamin C. Sodium also brings in vitamin C into the brain and into our bones. So it's actually very important for brain health and bone health. And we know low sodium levels in the blood is associated with unstable gait and falls and fractures. And people with cognitive impairment that are diagnosed pre-dementia actually might just be literally deficient in salt. And then there's the other part of salt, which is chloride, which makes up our stomach acid, hydrochloric acid. And if you want to break down the food that you eat into and absorb the minerals, you need to have an adequate amount of chloride. And so, salt literally gives us chloride, which allows us to digest our food, absorb nutrients, prevent bacterial overgrowth. And so, salt is extremely important.
Yeah. And so what are some of the ways that salt helps to give us energy? So is one of the signs of, salt and mineral deficiency fatigue?
Yeah, absolutely. So salt gives us energy in so many different ways, from making sure the adrenal glands have enough vitamin C, giving us iodine. And so obviously, in order to have, healthy thyroid function, you need iodine and you need good amounts of salt. And that gives us energy, having a good, our thyroid function. Salt gives us energy by maintaining our magnesium status. So we know that literally ATP energy is not ATP. It's not activated until it's bound to magnesium. And so everybody wants to take caffeine and this and this and that. And it's like, nope, energy is magnesium ATP. And if you're not getting enough salt, you're depleting your body of magnesium and you're not going to have activated ATP. So that's another way how salt gives us energy. And also low salt diets cause insulin resistance, and giving actually higher amounts of salt to diabetics has been shown to actually reverse their insulin resistance. And so we know that when you're insulin resistant and you have high levels of insulin, that is locking in your ability to access your stored fat and protein for fuel. So you're starving of energy when you are more insulin resistant. So salt provides insulin sensitivity, and that way it also provides energy. And if you go on a low salt diet, heart rate generally goes up pretty dramatically. And so you're like a less efficient human when you're consuming low amounts of salt, because your heart rate is so elevated, and you're literally, you could go up. I've seen studies showing that people have a 25% elevation in baseline heart rate. So instead of their heart rate being 80 beats per minute, it could be 100 beats per minute. And so that is just a huge energy suck on the body, having to beat 20 beats per minute every minute because you're not consuming adequate amounts of salt.
Yeah, I'm going to read your book. So you have a book called The Salt Fix. Can you talk a little bit about in there what people can expect? Because I think it's a really important book. And you mentioned when we were talking before the show that you spent 3 years writing it. And I think it's really important for people to educate themselves about this, because adequate salt intake is one of the most basic foundational things that you need to do for your health. And you need to be educated about it so you know what salts to choose and what salts to avoid.
Yeah, so the book basically, it starts kind of where we got it wrong with salt. It goes into then like a little bit of an evolutionary perspective of sources of salt that, a lot of people think, well, we didn't evolve eating nearly the amount of salt that we eat today. And I kind of show that, well, we used to consume the entire animal, which contains blood and interstitial fluid and lymphatic fluid and skin and organs and all these sources of salt. And we used to access the brains of kills in the African savanna, and we were able to get salt that way as well. And so, I kind of show and make a case that we didn't necessarily evolve on a low salt diet, and there's many ways to get salt, including going to salt licks. I mean, if animals were smart enough to go to a salt lick, I think humans are smart enough too to find sources of salt and consume them when they didn't get enough. And then, the book kind of goes into a little bit of the lack of evidence of the low salt advice. And it shifts over a little bit into how low salt diets cause fat gain and insulin resistance, and how eating more salt can improve insulin resistance. And then it goes into a connection between low salt diets causing sugar cravings and sugar addiction. And I kind of talk about how do animals know to go to a salt lick when they're depleted in salt? And the mechanism is the brain's reward system becomes hyperactivated. And that's smart, because that will then cause the animal to like the salt more and crave it more. But unfortunately, this other white crystal that is available nowadays can hijack that system, and low salt diets can potentially make sugar more addictive. And
that's a really interesting point I wanted to elaborate on, because at one point, I know I was very, very mineral deficient. I wasn't paying attention to salt. I wasn't eating a good diet, and I was craving sugar all the time, and definitely a sugar addict. And I was also craving potato chips all the time. So anyone out there craving Doritos or things flavored with regular salt or MSG, that's just your body crying out to feed it more salt. And so if you're craving potato chips all the time, at least try to get the ones with like the natural salts, the sea salt on them, or just don't eat those and heavily salt your food with regular sea salt. And when I started supplementing with minerals on top of sea salt, I was amazed, and I never looked at another potato chip again. I was giving my body the minerals that it needed, and I didn't go towards those cravings.
Yeah, no, that's a great example of a lot of people do crave potato chips for the salt, and they're just like poisoning themselves with this toxic amount of refined carbohydrates, and sugars, and that can cause people to over retain salt. And so it's like, don't blame salt for what the sugar did. A lot of people can just cut the sugar and then they can lose their salt sensitive high blood pressure. And so, the focus has always been on salt, and it really needs to be the other way, Crystal, because salt is an essential mineral and sugar is a non-essential macronutrient. We don't need to eat a single gram of exogenous sugar, whereas we obviously need to consume a lot of salt. And probably the most important chapter in the book is where I discuss what things cause us to become salt depleted. And, things like caffeine and low carb diets and exercise and all these different disease states like celiacs and inflammatory bowel disease where we don't absorb salt well, and all these conditions that can cause damage to the kidneys and cause salt loss. And just consuming 4 cups of coffee, we can lose over a full teaspoon of salt out in the urine.
Wow.
And so, it's kind of become a little bit of a craze. People are now putting like mineral salt on their coffee. I do a little bit, but not.
Replace what you're losing.
Yeah, exactly. But I like to honestly just salt my food rather than put it in my coffee. I'll do maybe a pinch of it.
Or salted butter in your coffee.
Yeah, yeah, exactly. I wouldn't do too much butter, but yeah, a lot of people are into that bulletproof coffee.
Yeah.
But and then so some of the final chapters are kind of like going into what are some healthy high salt foods like clams and seafood, crab, lobster, olives, cheese, healthy foods that you can eat and integrate more salt into your diet. And then how to dose yourself with salt before exercise and how much salt we lose per hour of exercise. And we lose about a half a teaspoon of salt per hour of exercise. And that obviously goes up as the outside temperature goes up.
Well, I don't sweat, so I don't have that problem, except when I'm in my infrared sauna. I don't know why. When I exercise, I don't really sweat that much. I don't know why. But yeah, a little TMI there. But so who needs more salt?
Yeah. Well, lots of people need more salt. And one of the signs of salt deficiency isn't really low sodium levels in the blood. And a lot of people get confused, like my sodium levels in the blood are normal, so I must have enough salt. And it's actually more symptomatic. If you are going from a seated to a standing position and you have a really elevation in heart rate, you can feel that, like you have POTS, which is postural orthostatic tachycardia syndrome. It's pretty common in women. Over 3 million Americans have that syndrome. Or if you go from a seated to a standing position and you're dizzy, or you are exercise intolerant, you have muscle spasms, muscle cramps, heart palpitations, those are real signs of potentially salt deficiency. And I've had a ton of people email me and say, James, I've had muscle cramps, muscle spasms, or heart palpitations for like years. And literally after 3 days of upping my salt intake, it's completely gone. And that may have also something to do with not pulling magnesium from the bone anymore by consuming more salt and upping your magnesium status. So salt, magnesium, there's this huge interplay between the two. And I think symptomatically, you can treat salt deficiency better than just a lab test.
Yeah. Yeah. And so let's talk about sodium and high blood pressure. Because I know a lot of people have hypertension, have high blood pressure. They go to the doctor. The doctor says, eat a low salt diet. Can you make some distinctions for them to help them feel, more comfortable in consuming sea salt and why that's just, a ridiculous notion?
Yeah, honestly, I think most of the evidence shows that a low salt diet actually causes hypertension in the long run, because a low salt diet causes insulin resistance and it causes an increase in all the stress hormones, noradrenaline and adrenaline, and it increases all the artery stiffening hormones. Literally low salt diets increase the progression and acceleration of atherosclerosis in animal studies. And so that can cause hypertension by just stiffening the arteries, whereas it's solely based on blood pressure. They think that it's going to prevent hypertension or a chronic elevation in blood pressure because it may reduce blood volume, and that may lead to a reduction in strokes and heart attacks. But you're just dehydrating the person. That is not preventing hypertension. That is just literally dehydrating someone and reducing their blood volume. Yet you're actually worsening peripheral vascular resistance with low salt diets. And so literally low salt diets most likely cause hypertension. And people who can't tolerate salt, where they consume salt and they have swelling in the legs and they have massive rises in blood pressure, there is something underlying going on. And that is not, we should not be blaming this essential mineral for causing that. There's that people can kind of look for to treat. So one of the main causes of salt sensitivity and over retention of salt is insulin resistance. And simply cut the refined carbs and sugar. And so many people have told me that they don't get elevations in blood pressure anymore. Their legs don't swell anymore. There's two other main underlying causes of over retaining salt. One of them is high aldosterone levels, and some people can have benign tumors on their adrenal glands and they're over secreting aldosterone. And we can treat that with either spironolactone and other medications to inhibit aldosterone, or we can just remove the benign tumor that's causing that person to over-secrete aldosterone. And then some people have Cushing syndrome, right, where they have like an increase in cortisol levels, which is causing them to over-retain salt and causing the release of salt in areas where it shouldn't happen. And then some people have leaky blood vessels from low magnesium, and that's literally causing the salt and volume to go into the interstitial fluid, which is causing the edema in their legs. It's due to leaky blood vessels. It's not due to the salt that they're consuming. And the leaky blood vessels can be due to a low salt diet leading to magnesium deficiency and causing the leaky blood vessels in the first place. It's not intuitive, all this stuff, but it's important to know that people shouldn't be blaming salt for those issues when they consume it and trying to discover what the underlying cause is.
Yeah. Let's talk a little bit about the best salts out there. So you've done a lot of research on different salts, and I'm a salt freak. I have like 10 different kinds of salts. I love salt. So what are some of the best salts that you recommend?
Yeah, so I mean, my number one in the book for 5 main reasons is Redmond Real Salt. And one, it's super cheap. For being an ancient salt and for having good amounts of other minerals, it's super cheap. And if you compare that to other salts, it's just not even funny. Like Himalayan salt is probably like 5 to 10 times off of real salt. And so that's one reason why I like it. It also has really good amounts of iodine. It also has good amounts of calcium. And it is from that ancient ocean source. So you're avoiding the modern day sea salts, which can potentially have that modern day pollution. So, that's probably my number one. Himalayan's not bad either. It also would lack the microplastics from sea salts from modern day oceans, and it has good amounts of iodine as well. But it doesn't have like the calcium that Redmond does, and and it also has kind of some radioactive elements in it, like plutonium and polonium and rubidium and some of these other things that are a little concerning. They're at low amounts, but it's like, if I can get a salt that doesn't have that, why would I not do that?
So you're saying that's in the Himalayan salt?
Yeah, the Himalayan salt has some radioactive elements in it.
Okay. Yeah. Do you know anything about Maldon salt?
Nope, never heard of that one before.
I think it's from Spain or something. It's something that I'm eating right now. So let's talk a little bit about sea salts and some of the toxins that are in sea salts, because a lot of people out there are eating sea salt, feeling like it's a healthier alternative. And I know the plastics and the microplastics are a huge problem in the ocean right now. A lot of fish are eating those and dying because of them. So what is it exactly that you could find in some sea salts?
Yeah, so I mean, there's been numerous studies that have come out recently where they've tested like 14 batches of modern day sea salts, and like 13 out of the 14 will contain microplastics, mainly the plastics that are used to make plastic water bottles, which makes sense, right? And so, we just don't know the health effects of consuming these microplastics, but I think like 95% of us test positive for those type of microplastics in our urine. So like we're all of us are exposed to it. But if you are consuming, salt that contains that versus an ancient ocean salt, that's definitely one way that you can cut and reduce your amount of potential microplastics in your body. And the other potential things that are in modern day sea salts is potentially heavy metals. And I don't think it's in super high amounts. We're talking trace amounts. So it's just, we don't have a study saying you're going to live longer if you consume this salt over that salt. But to me, if you can get a cheap, like ancient ocean salt, why wouldn't you?
Yeah.
It's just,
and then metals are also a concern. I mean, the ocean is full of mercury, and the sea salt does not escape that. I mean, is mercury a concern in some of the sea salts?
I think there are definitely traces of mercury in some of those sea salts. And, another underestimated heavy metal is cadmium. Cadmium is in our food and it's in our water. And, eating organic foods, a lot of people kind of hate on organic, like there's no evidence, blah, blah, blah. But a systematic review, a huge meta-analysis of randomized studies have shown that organic foods contain less heavy metal, the heavy metal cadmium. And, the high amounts of cadmium have been associated with stroke and hypertension and cardiovascular disease, and it just builds up in your body, and especially the kidneys. And cadmium is also in cigarettes. And so, there's heavy metals and minerals kind of balance the heavy metal toxic load in our body. And so one of the best ways, like a lot of people fear mercury, and it's like if you have a good amount of selenium, like a fish that has some mercury but really high amounts of selenium is probably less toxic than a fish that has low levels of mercury but really low levels of selenium, because selenium balances it out. So it's like these good minerals can kind of fight against some of those heavy metals.
Yeah, minerals help to detox your body. They replace metals and enzyme binding sites in the body, and they kind of like push them out. And with like cadmium, that causes more cancers than all of the other metals combined. And it's in the oceans, just like mercury, because of fossil fuel burning. It's gotten into the air, and then it settles into the oceans and has accumulated there in the fish and the salts and etc. So let's, did you want to add something to that?
No, you hit it right on the head.
Yeah, and so is there anything we haven't talked about that you wanted to add to our conversation about salt?
Yeah, a lot of people always ask me, like, how do I dose myself with salt? And so I kind of went to the lab and started doing different things too to try to see, because I'm just like, I can take it straight up and wash it down with water, but a lot of people find it nauseating, and some people were kind of posting and showing that they were putting salt in capsules because it was making them very nauseated. So people are coming up with really cool ways to dose themselves and get salt into their body. So, and just like with everything, some people can handle taking salt straight up, and some people need to really get kind of funky with how they're dosing themselves with salt. But what works really good for me is I'll put like a half a teaspoon of Redmond real salt in a cup, and I'll put just enough lemon juice to coat the salt, and then I'll put about 2 ounces of water, and I'll just kind of mix it up a little bit, and then I'll take it, and it tastes like a lemon shot, and it's done. And it's super simple, and I don't ever feel any nausea from it. So people kind of use what's called like Keto aid, and so it's like salty Gatorade without the glucose in it. But you can take like a half a teaspoon of salt, and you can put lemon juice and lime juice and then fill it up with water, and it's like a lemon lime Gatorade but without the sugar. So that's kind of a cool way to get salt in before you work out. And what's interesting is I never realized that even these salty sports drinks like Gatorade and Powerade, they are about a quarter of the concentration of salt in your sweat. They don't provide nearly enough salt. And so if you're not replacing, it's not even just about replacing what's being lost. Dosing yourself with salt increases blood volume and blood circulation. There is a real pharmacologic effect to it, to giving it to yourself, but beyond just replacing what's going to be lost. And so I don't ever work out now without dosing myself with salt, because I'll start getting the workout headaches within 5 minutes if I don't do it. And I always can work out harder, faster, longer when I dose myself with salt. And the wait time between my sets goes down. My recovery seems to be quicker as well. And a lot of people have told me that. And the other cool thing is low carb diets. People, the keto flu, it's such a salt waster, and so many people can't get on the low carb diets because they're losing so much salt. But they don't realize that that's what's causing their keto flu, where they're dizzy and they're exercise intolerant. They just feel really bad. And even if you talk to some of the experts like Dr. Finney and Volek, they really recommend for at least the first couple of weeks, people need an extra couple grams of sodium per day.
Oh, that's really, really interesting. Yeah, I had when I've tried keto a couple of times, I've really had a problem with feeling like the lightheadedness and nausea and things like that. So that's a really interesting solution to that problem.
Yeah.
Yeah, and so everyone go get James' book, The Salt Fix. It's on Amazon. And how long has your book been out?
About 3 months.
Okay, fantastic. Yeah, I highly recommend it. I'm going to go get it myself, and I think it's going to be really, really interesting. I talk a lot about minerals on the podcast and on my website. It's really, really important to educate yourself about minerals and salt and dose adequately. And people can also take as a tip to get salt in the body, they can do Epsom salt baths, right? Correct?
Yeah, I think that has more of like a local effect, like to the muscle. But yeah, I mean, Epsom salt baths, so many people say their skin, psoriasis or eczema goes away. And there are real benefits of like people like will go into like the Dead Sea and like all of a sudden their psoriasis is gone and like literally like giving like high doses of salt. People with like cystic fibrosis or like some people with these lung issues that go into like these salt caves and inhale salt. Like there seems to be some benefit too of like topical and aerosolized like saline. So there's some interesting other ways, and I don't talk about that in the book, but it's just kind of cool how like salt seems to be therapeutic, more than just ingesting it.
Yeah, there's a Korean spa that I go to. They have a Himalayan salt room where you can walk in and you're obviously, breathing it in and absorbing it in some way. And it's interesting. I go in there. I'm not really sure of the benefit, but I go in there. You don't really feel anything, but you are being affected by the salts positively. Yeah, well, thank you so much for coming on the show. Why don't you tell the listeners where they can find you and get your book?
Yeah, so people they can get my book on Amazon or Barnes and Noble nationwide, and they can find me at Dr. James DiNic on Twitter and Facebook and Instagram. So
Fantastic. Well, thank you so much, James, for coming on the show.
thanks for having me.
And everyone, if you want to learn more about minerals, you can go to my website, live to110.com. Thank you so much for listening to the Live to 110 podcast.